Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Dr. Amir MS from Medicare Clinic Soil 1920. I'm a general physician in HSR Layout, Bangalore, India. And I'm going to tell you to all those patients who are suffering from any disease and want to have some clarification regarding the month of Ramadan. I would like to clarify that if your illness is progressed to such an extent that you are having a lot of hardship you face a lot of hardship, you have to take some IV medicines or which are very mandatory, and you are almost hospitalized, or you need daycare, medical care every day, or you have a lot of hardship which makes it very difficult for you to fast. There is an ayah in the Quran, which is from chapter 2 Baqarah, ayah 184, which goes like this: Ayyaman madutatin faman kana minkum maridan awwala safarin faidatun min ayyamin ukhraya wala allazina yutikhunahu fidyatun tamu miskinan faman tatawa khairan fahuwa khairun lahu wa tasumu khairun lakum in kuntum talamun, which translates to fasting a limited number of days. So, whoever among you is ill or on a journey, so also if you're traveling, you're exempted from fasting, but you have to make up for those days of fasting after the month of Ramadan. And then an equal number of days are to be made up. And upon those who are able to fast with hardship, a ransom, a substitute of feeding a poor person each day, which means you have to calculate the amount that is needed to feed a person each day, and as a substitute for your fasting. This also applies to people who are very old and find it very difficult to fast. You can calculate what is the amount as per your wish. You can give excessive also, which is good for you. You can calculate an amount and give it to a person so that he is able to eat for an entire day, and this is a substitute as a ransom for being unable to fast, so that you have the exemption from the sin of not fasting. And whoever volunteers excess, it is better to him, but to fast is best for you if you only knew. Means fasting is recommended in all conditions, but if in the unfortunate circumstance that you find it extremely hard, you can calculate a day's expense for feeding a poor person and give it to him. And also about people who are taking medications, all medications are advised to be taken before starting of the fast, which is before the pre-dawn meal. And you can take other medications after the after breaking the fast. And as for diabetics, it is advised to be very careful if your diabetes is has a tendency to fluctuate to extreme levels, and you have to titrate your doses every day for managing the sugar levels. You have to be very careful. It is better to control your diabetic levels, make sure they are stable, and then try to get into fasting. And if you can take all your diabetic medications after breaking the fast. Make sure so that before the pre-dawn meal your sugars are really under control. But it is recommended not to take heavy doses of anti-diabetic medications, which is tablets or insulin injections, before the pre-dawn meal, because there is a risk of the sugar levels falling to very low levels post fasting, especially towards the afternoon and evening. So you have to be very careful, because hypoglycemia, which is the sugar levels going very down, is very dangerous, and you can just lose consciousness, develop sweating, beating, feeling of heavy beating of the heart, and collapse and fall down. So you have to be watchful. Do not take high doses of anti-diabetic medications or injections, insulin injections, before the pre-dawn meal. But after the break of the fast, you can check your sugar levels and titrate your dose and take the medications. BP, blood pressure medications can be taken before pre-dawn and after breaking the fast. And asthma medications, inhalation is allowed, but it is better to also control your asthmatic condition with a physician before starting fasting. And injections also, you have to be very careful. You have to visit a physician and take a decision of how important these injections if any emergency arises, have to be taken. So you have to be very, very careful, especially diabetics. If you want further clarifications on management of your conditions, kindly visit the clinic, Medicare Clinic Soil 1920 in HSR Layout, Bangalore. You can Google the address, and be very careful with all your medications and managing your conditions. If you want a complete evaluation and advice on your personalized health condition, you can contact the clinic. I wish you all a very happy Ramadan and happy fasting. Kindly like, share, and subscribe with your friends. Jazakallahu khair.